Hi, my name is Katrina Apostle. I'm here with the purpose of evaluating and presenting the recommended healthcare information system for the given scenario. The scenario is as follows. You are the head of the informatics department at a 220 bed community hospital that already has computerized documentation for nursing and other ancillary staff. The hospital is considering implementing computerized physician order entry, or CPOE, for their providers. One of the requirements will be that providers want the ability to place orders from within the facility, their home office, and their mobile devices. As the head of the informatics department, you will need to make a recommendation to the Chief Financial Officer, or the CFO, advising whether to upgrade the existing system or implement a new system. A computerized physician order entry, or a CPOE, is defined as an electronic prescribing system that utilizes patient medical records to prevent errors when ordering new prescriptions. Prior to CPOEs, many preventable adverse drug effects, such as drug overdoses, overlooked drug allergies, and incorrect drug administration, were occurring due to illegible handwritten prescriptions. 20% of these adverse effects were also found to be life threatening, as 7,000 annual deaths resulted from adverse drug effects. Furthermore, one medication error would contribute to an average of $2,000 worth of hospitalization costs. This would lead to more than $7.5 billion of annual hospital costs nationwide. For this reason, implementing a CPOE is beneficial in reducing errors, decreasing hospital costs, and promoting patient safety. In fact, recent study conducted at Boston's Brigham and Women's Hospital showed that CPOEs have decreased errors by 55% and medication errors by 88%. So integrating CPOEs have been efficient in decreasing errors. We're going to start with a request for information, or an RFI. According to Hardy, an RFI is defined as a request made typically during the project planning phase, where a buyer cannot clearly identify product requirements, specifications, and purchase options. In healthcare practice, RFIs are used at the beginning of a system's life cycle to determine which of the vendors' services, like a CPOE in this case, would be optimal in integrating into the organization. This is where data is collected and compared among all vendors. When there's a better understanding on what is required, we can move into the planning phase. This is where the informatics team and administration take several factors into consideration, such as staff training, expenses, etc. This is also where RFPs are developed. An RFI differs from a request for proposal, or RFP, because an RFP is a detailed document requesting organizations for a specific product or service, whereas an RFI is a document that is requested to gather information to determine which vendors are to be utilized for their organization. A chart comparing an RFI and RFP has been provided to the right-hand side of the slide. When creating an RFI, the content should include an overview, requested information, response expectation, and clarification. First, the overview should be an introductory, where it explains what the requesting organization is and what their short and long-term goals are for the future. This is where basic information is provided to the vendor regarding the requesting organization. Second, the RFI should specify what information is required from the vendor. This may include the functionality of a product, delivery time, etc. Third, response expectations should be addressed by including how and when they're required to respond by. Pre-made templates or formats should be utilized because it makes it easier to compare responses between various vendors later on. In addition, RFIs and RFI responses can be submitted electronically, so this method makes it easier for both vendors and requesters. Lastly, last-minute clarifications need to be identified in order to prevent any confusion during the process. An example of an RFI has been provided on the left-hand side of the slide. According to the given scenario, there is already a computerized documentation system in place, so we need to evaluate the requirements between upgrading the current system and implementing a new system. This way, we can determine the best route for the scenario. The Staggers and Nelson Systems life cycle model has 8 steps: analyze, plan, develop or purchase, test, implement or go live, maintain and evolve, evaluate, and return to analyze. Before we can make a decision in upgrading or changing systems, we must first go through the analyze and plan stages. In the analyze and plan stages, a few factors need to be taken into consideration. That be affordability, sustainability, and efficacy. If the organization were to keep the current system and upgrade it, would it be within the budget? Will it be able to achieve its intended tasks and meet its requirements? And will it bring practical results? According to Offeld et al., implementing a CPOE system in a 200-bed hospital, such as in this scenario, can cost approximately $500,000 to $4.1 million depending on the existing computerized system. Additionally, annual maintenance costs following the first year would approximate between $174,000 to $470,000. In regards to sustainability, current CPO systems have the ability to be portable. This means implementing the CPOE will allow providers to place orders outside of the facility through a mobile device or a laptop, and therefore meeting the scenario's requirement. However, staff members need to be trained on the updated system, so time and resources need to be taken into consideration. This would also be the stage in which RFIs are sent out to different vendors in order to collect and compare data. Lastly, studies have shown CPOE's efficiency in decreasing errors that have previously led to adverse drug effects. As mentioned in slide 4, studies have shown that CPOEs have significantly decreased errors by 55% and medication errors by 88%. On the other hand, implementing a brand new system would cost about $162,000 or $6,200 per user per year. This means that the price is dependent on the size of the facility. In regards to sustainability, the portability requirement would also be met as many CPOEs have this quality. However, the transition period may be more tedious as the entire facility learns to navigate through the new system. Staff members may work slower and less efficiently in the beginning as they continue to learn. However, there is a positive long-term effect as the new system is supposed to improve productivity in the workplace and decrease errors. The efficacy would be the same as upgrading the existing system. In conclusion, I believe it would be a better option to upgrade the existing system. Unfortunately, knowing the current computerized system in use would be beneficial when making this decision. If the current system is not user-friendly or prone to staff error, then I would opt for a new system. Assuming this is not the case, however, upgrading the existing system would be a better option because it does not require more staff training or a longer transition period. Having to learn a completely new system will be difficult for the entire facility as everyone would be learning, thus decreasing their productivity. Cost, on the other hand, is not too much of a concern because it will eventually be paid off. As mentioned earlier, adverse drug effects have led to more than $7.5 billion of annual hospital costs nationwide, so implementing a CPOE will aid in cutting down the costs. Thank you.